Why early diagnosis matters. The symptoms of autism spectrum disorder, or ASD, vary from child to child. Each child is unique. Your child's pediatrician is a great source of support if you have concerns, but no one knows your child like you do. So, what signs might you notice in your child's behavior, and why does early diagnosis matter? Early signs of ASD. The indicators of ASD appear around 12 to 18 months. However, some symptoms occur even earlier, during the first 12 months. Caregivers may notice a lack of response to their baby's name, poor eye gaze, decreased shared attention, and fewer variations in facial expressions to show emotions like surprise or anger. But these signs may be subtle or less obvious to a medical professional during well-baby visits. Many pediatricians include a screening as a standard of care for all patients, but visits are brief and occur less frequently as your child gets older. Sharing your concerns is crucial so that your pediatrician can explore additional screening with you. In addition to language, reports of repetitive behavior are concerning for medical professionals. At home, you might notice your child playing with toys in the same way, or they might get fixated on specific parts of objects, like wheels or sounds. As your baby becomes a toddler, you might notice that they react strongly to minor changes. They might engage in hand flapping or toe walking, or you might notice that they are sensitive to certain sounds, smells, tastes, or textures. These are important observations to share with your child's physician. You have shared your concerns. Now what? Caregivers often talk about the process of getting a diagnosis as a journey, both in navigating the medical system and their emotions surrounding a diagnosis. If you have shared your concerns with your child's pediatrician, the next step may be a screening tool or a referral to a diagnosing provider for a formal evaluation. Some screening and diagnostic tools that have been found to help make the diagnosis are the Modified Checklist for Autism in Toddlers, or MCHAT, the Social Communication Questionnaire, or SCQ, the Parents' Evaluation of Developmental Status, PEDS, and the Childhood Autism Rating Scale, CARS, or CARS, among others. However, a referral from a physician is not always necessary to request a diagnostic evaluation, and if indicated, receive services. It is possible for a parent to self-refer. If you think your child may have a developmental delay related or unrelated to autism, he or she may be eligible for early intervention services. The Individuals with Disabilities Education Act, IDEA, says that children under the age of 3 who are at risk of developmental delays may be eligible for services. These services are provided through an early intervention system in your state or territory. Through this system, you can ask for an evaluation. Following an ASD diagnosis, early intervention. Early interventions occur at or before preschool age, as early as 2 years of age. In this period, your child's brain is still forming, meaning it is more plastic or changeable. Although the window for learning language and other skills never closes, the brain's ability to adapt to the complexity of language becomes increasingly difficult to alter over time. Early plasticity means it's easier and more effective to influence a baby's developing brain architecture than to rewire or form these connections later. Because of this plasticity, treatments introduced early have a better chance of being effective in the longer term. Early interventions not only give children the best possible start, but also the best chance of developing to their full potential. The sooner a child gets help, the greater the chance for learning and progress. Recent guidelines suggest starting an integrated developmental and behavioral intervention as soon as ASD is diagnosed or seriously suspected. Diagnosis can open up opportunities for therapy for your child, but it can also provide you, as a caregiver, with support, understanding, and community. Your journey through diagnosis may be a road to both acceptance and action. Here at Learn, we are committed to helping your child and family find success at each step of your family's journey. Raising a child with autism isn't a one-person job, and we're here to help. Follow along with our YouTube channel and find helpful tips each month. Please leave a comment below with questions or suggestions for other topics.